everyone. This is Margaret Owen, and I am presenting my paper, which was on current issues in hospice services. I chose this topic because I've been working in our local hospice for about 4 years now, and I have found through working with the patients and the staff and in the office as well that there are many issues involved in hospice specifically. The issues that I addressed in my paper regarded the culture, the marketing, the changes in the Medicare regulations that they face, the budget challenges, and the administrative staffing and volunteer staff as well. First of all, the culture of death and dying is a very big negative for promoting hospice services in a community. There are poor communications, and many patients unfortunately don't know about the programs and enroll too late. Many families and patients do not have the discussions and the end of care planning in place that promote hospice in the community. So it's important to promote community education programs with church coffees and senior care facilities, and to promote advanced directives as well. It helps to plan and bring up discussions and conversations. And then I also discuss in my paper specifically the example of Respecting Choices program in La Crosse, Wisconsin, which has been a proven program to help get over 96% of the patients in an advanced directive in La Crosse last year. The marketing for hospice is usually very minimal. There's often no marketing budget, no marketing staff, and no marketing plan in place. That currently is the case for our local hospice here. So it's important to focus on marketing plans that include fundraising and getting a budget for marketing, as well as using outside collaborators that shared health care systems in the community to help with these programs and funding. Another issue for hospice is all of the Medicare regulations and guidelines in the program requirements, as well as the changes in the Affordable Care Act and the decreases in the reimbursements and benefits that Medicare is providing for hospice services. Which brings me to another issue, which is budgeting for hospice. That's probably one of the largest challenges. They face these decreases in reimbursements, the fluctuation in patient enrollment month to month, the increases in medical supplies that will be required from the increase in senior populations in future years, and a reliance on donations, private donations, and how that can be influenced by the economy in the local area. So it's important for administrators to use a dynamic or flexible budget structure. They need to have somebody, at least one person, a CFO or something, dedicated to watching the revenues and expenses on a 24/7 basis, and someone who focuses on fundraising as development. Another issue for small hospices is the staffing in the business. Many hospice staff are comprised of RNs and social workers, and as dedicated as those people are to their work, they are not business-minded or trained for those jobs. So it's important as a hospice grows for trained administrative staff to be hired and brought into the hospice. Therefore, there needs to be costs and budgeting set aside and associated for the administrators as the hospice grows. And Medicare also requires every hospice to have a volunteer program. So it's great to continue training volunteers, more and more volunteers as they grow. But it's also a nice idea for administrators to think about target marketing the future seniors in the community. As these senior populations grow in upcoming years, there is opportunity for them to come in and be a part of the volunteer program in a community hospice. There are successful hospice models, such as Hospice of the Valley in Phoenix, Arizona, that can provide great mentoring and networking and resources for smaller hospice administrators. They usually have a very strong administrative structure already in place, as well as developed marketing and fundraising programs. Hospice of the Valley actually also has a very well developed website that all by itself can be a source of ideas and approaches to dealing with a growing hospice and community population for the local administrators to follow. As these administrators do face the many issues of hospice, it's very important for them to remember to focus on the mission and the vision of the hospice. Remembering that hospice is a patient-centered care that treats the physical, emotional, and spiritual needs of both the patients and families. It provides lower cost care than in acute care settings, and it helps to change the culture in end-of-life care, providing meaningful conversations and a quality of life for patients as they reach this important stage in life. So that concludes my presentation. I hope that you enjoyed it. Thank you.